folks who reach out to us after this meeting, who ask, what is it that we talked about and everything. So we want to be able to provide a recording for folks who are not able to join these meetings in person or live, I guess I should say. So anyways, thank you all for coming. We really appreciate it. So really quick, we have a guest speaker today who is Jacob, but I wanted to go over some very important updates with you all, both federally and locally. Our Ariella will be putting the link into the chat box for folks to be able to view what it is that we're going over. So right now, the Biden-Harris administration is accepting public comments on the changes to Section 1557, and also to Title IX. They're really wanting to put into Section 1557 and Title IX that protects LGBTQI healthcare and access to healthcare, as well as LGBTQI plus students, those who are in school, to ensure that they're not discriminated against or harassed. That really protects our queer students across the nation. So right now, they are accepting public comment as well as public stories for folks to submit. The federal government is taking comments through October 3rd. And then they're also taking stories, I believe, until Friday. So if folks do not mind clicking on the link and please make those public comments, you will see that there's several organizations that are collecting letters of support and everything. If you have the capacity and time, or if you can really make this a priority, we need as many voices as possible to ensure that our community has access to healthcare and our students have that access to public safety while in school. Regarding these Section 1557 and Title IX, the National Center for Trans Equality and GLSEN is doing a live event today about these campaigns on their Facebook page at 8 p.m. Eastern or 5 p.m. Pacific. So please share this information on your social media, link it to your members. This is a really great way to learn exactly what the changes are that are being proposed, and for you to also ask any additional questions that you may have. So again, this is a really important situation where we need as much public comment and student stories as possible. And again, please make this a priority as time is running out to submit those letters of support, public comment, and stories. So this is, like I said, a really great way to gain additional information. Also, in regards to Section 1557, this morning, the Center for American Progress released a brief summary that really addresses the non-discrimination protection for our community that is proposed in Section 1557 of the Affordable Care Act. And this brand new data, so like I said, just released this morning, is a 2022 nationally representative survey to really highlight the discrimination our community encounters when interacting with healthcare providers and insurencers. So Ariella did put the link in chat for all of these events and for this briefing. And this briefing is actually another great way and tool to utilize as you create presentations to train healthcare providers and insurers. So we really want to make sure that all of you have this brand new data that was just released for your use when it comes to trainings, any type of webinars you put on, or even as you're applying for grants and various funding. So we really want to make sure that this was available to you. This is very important information that is going on federally that we wanted to ensure that you all had access to. As for locally, what's going on in the state, Senate Bill 923, the TGI Inclusive Care Bill, was officially submitted to the governor's desk on August 31st. So now we are all rallying around to encourage the governor and really push for him to sign this legislation into law. So so we're really asking folks to support this policy effort. So again, Ari put the link in chat on how you can support this effort by sharing posts on social media, submitting letters directly to the governor, and all of the good things. So that the more pressure we can put on the governor, the more of a chance that we can get this signed into law and it go into effect in the very near future. So this is a really huge thing to mandate that insurance providers create a directory of providers who are TGI inclusive and culturally sensitive within their practices. And then lastly, locally, what is going on is there is a task force of California LGBTQ community response to the monkeypox pandemic. We have a webpage that is dedicated with resources and advocacy tools that is updated as often as possible as things change and pivot. We have a meeting in collaboration with Equality California twice monthly. Our next work group meeting is tomorrow at 3 p.m. It is every other Friday from 3 to 4 p.m. We have a listserv that is strictly dedicated to the monkeypox pandemic, where folks can share resources, strategies, challenges, and barriers, which is also something else that we talk about in this meeting. We also have a social media toolkit that we've been creating and updating with this group. And then we have also gained official confirmation from the California Department of Public Health that they will be joining this meetings and providing additional updates that's outside of their website. They update their website as much as possible there, but they understand that LGBTQ organizations across the state are hitting these various challenges and barriers when it comes to lack of access to vaccines and folks needing to travel either to LA or the Bay Area from rural areas of California to obtain this vaccine. So they really want to engage with our community and be a part of this work group to ensure that we're all working together as one cohesive unit to ensure that we have the resources and strategies needed to really address this pandemic. So if you're interested in joining this work group, like I said, our next meeting is tomorrow at 3 o'clock, and we have a meeting every other Friday from there, as well as a listserv. Please email me, and I am more than happy to send you the calendar invite, add you to the listserv, and get you access to all of the resources that you will need. But again, we also have it on our webpage on where you can access the resources. So yeah, please let me know and feel free to email me to participate. Within our programming, we have our tobacco control project where we are the LGBTQ statewide coordinating center across the state for the California Tobacco Control Program within CDPH. Ariela Isaias and our entire communications subcommittee created various educational interview videos for community members by community members, where they really shared their stories of how they were able to quit tobacco, why it was important to them, all of the things. So we have these videos available for your use up on our website. So please feel free to utilize these videos and share it out with your community so that way folks can live healthier and happier lives. And then the final thing for our We Breathe project is a very extensive policy platform was written and it is finally complete. Ariella is just moving the complete document and making it very pretty on this wonderful document that she created. So that policy platform, which provides a lot of systemic recommendations and a lot of recommendations on funding for LGBTQ organizations from CDPH, is within that document. So that is coming out October 2022, so next month. And there will be an introductory webinar about this platform and how you can even utilize it to advocate for funding for your communities. So please be on the lookout for that document as well as the introductory webinar, and we will be sure to advertise it not only here on our network monthly meeting, but also in our newsletter. So with all of that, I really wanted to give plenty of time to Jacob, the CEO and founder of QueerWorks. For those of you who do not know Jacob, Jacob is an amazing advocate and mental health provider. He has served as the chair of the West Hollywood Transgender Advisory Board, as well as influencing legislation both here in California and nationally. Jacob has been on Oprah, on BuzzFeed, on Dr. Phil, and various news sources to really bring that unique voice to an ignored cause. You know, our community has been ignored on so many levels, and Jacob really advocates, you know, to be a voice to ensure that we are seen and heard. Jacob is doing something brand new and innovative within the Coachella Valley right now. He is advocating for a universal basic income pilot program to take place throughout Palm Springs and the Coachella Valley that will give up to 180 individuals unrestricted monthly stipends for 18 months with a focus on the transgender and non-binary community. There's a lot of information to share. I'm going to turn it over to Jacob, and he is also going to share how you can also get engaged in advocacy with him in regards to universal basic income. So with that, I am going to turn it over to Jacob, and you should be able to share your screen. So thank you, Jacob.
Awesome.
Welcome.
Awesome. Thanks. One sec. Can you all see it? Cool. I did it. Wow. Hi, everyone. My name is Jacob. Once again, he, him, his pronouns. I'm the CEO and founder of QueerWorks. I'm an LA baby, born and raised. So I have been in the Coachella Valley for a little more than a year now. Not the biggest move, but definitely makes a difference in temperature, climate, and resources, which I didn't think about. You know, I live in Palm Springs and I think, wow, there has to be tons of things for the LGBTQ community. That's where we all go to retire. But I learned very quickly that we really only have resources for a very specific demographic in the community, which is gay men who are over a certain age. And so that really got me thinking how we can begin to expand services throughout CV. So I'll just kind of dive in. I talk a little fast. If you need me to slow down or repeat or you have a question, let me know. Danny, I do have like the chat and Zoom and the other screen. So if someone has their hand up, if you could just ping me, I would super appreciate that.
Absolutely.
Thank you. All right. So a little bit about QueerWorks. Let me just first say I am a licensed therapist. I've been licensed for a few years now, but it takes a while. So I've been in the psychology world for about 8 years. When I realized very early on in graduate school, there was really not a lot for LGBTQ plus individuals around accessing any type of mental health services. You either had to have no income or have unrestricted income, right, in order to be receiving services. But what about everybody in the middle? And so that kind of got me started with QueerWorks. So 2018, it was my dissertation project. The idea was just to provide therapy, one-off therapy to people who needed it for free to, supplement my income, I would see clients and then see free clients. The pandemic hit, and I said, you know what, I'm not going to be making money anyways. No one's paying for therapy, so I might as well offer it for free to people who need it. And that's kind of how this free therapy program was born. I just started seeing clients who reached out, started searching for ways to fund it, and I found a grant through Riverside County, and it's a housing and homeless navigation grant. And so I said, well, I can help house people and provide them therapy. So thanks to the Riverside County COC grant, we're now a team of 5. When was our official launch date? Date was July 1st, 2021. So it's been about more than a year now. We've been able to serve 200 individuals in just 1 year, completely free services, either mental health, housing navigation, referral to medical treatment, anything that has to do with case management, we're able to provide through Riverside County. In addition, we're able to see clients for free via telehealth throughout California. So about 40% of our clients are outside of the Southern California region, which is pretty cool. All of our services, like I said, are telehealth. We have 2, 3, 4 right now, soon to be 7 interns. So they see our clients. In addition, they're getting their clinical hours. And the idea is that once they're licensed, they get to go out into this world and provide affirmative, hopefully free, or not free. We don't want people to work for free, right? But affirmative, low cost or accessible therapy to the community. My goal, my 5-year plan, right, is to be able to serve 1,000 individuals a year, become a nationally recognized organization, and then ultimately influence policy reform around mental health access, which I believe, but I'm biased because I'm a therapist. Really, if you can't access mental health services, it's really difficult to maintain and access everything else. So that's just a little bit about QueerWorks. I could go into, an hour-long like origin story, but happy to share more one-off. So the project we got funded for through the County of Riverside, excuse me, sorry, my dog has the sneezes today. If you don't bless them, right? If you don't say bless you, they get mad. Anyways, so a project that we got funded for was the Trans Power Project, and it's a program of QueerWorks. So the Trans Power Project's goal is to collect, sorry, hold on, Pudge. Give me 1 second. I need to get her quieted down because she'll bark this whole time. Come here, Pudge. All right, we all get to hang out with Pudge. Okay, so our goal is to connect trans, non-binary, and intersex clients to immediate needed triage services such as mental health, jobs, right? Everything I talked about earlier. Then our goal is to connect these clients to local organizations so that they can continue to get their ongoing care. So I've partnered with DAP Health out here in the Valley. I've referred people to Borrego, Planned Parenthood, all these services that we vetted that will treat our clients with care, compassion, and meet them where they're at in terms of finances. We also hope to teach or instill self-advocacy techniques because we believe that this long-term resiliency will help to keep our clients in a place of stabilization, right? People go back and forth, we don't just fix a problem right away, but the next time that they need help, they'll now be able to know how to access that help. So the goal is to continue this cycle of help, I guess, self-help. I'm going to make it up, self-helpness instead of helplessness. And so that's our inaugural program. We're in our 2nd year right now, which is really fun. Here are some of the services, like I mentioned, mental health care, housing. This has been really great. We just got rather large chunk of grant money to do rapid rehousing for victims of domestic violence. It's open to every sexual orientation and gender identity, but we're really making a concentrated effort to house LGBTQ plus individuals. We actually just housed, we launched in July and we just housed our first client 2 days ago. So now she is living, we're paying her rent up to $1,200 a month, and she's in a safe bed for the first time in 4 years. We help with employment. My background before being a therapist was in talent scouting, talent retention, recruiting. So I have an affinity for resumes and interviews, and then personal health care. So we allocate clothing, food, hygiene supplies. We've partnered with organizations to do HIV testing, medical insurance enrollment. And we just actually, part of our county grant, we just launched in July our mobile shower and our mobile clinic. So we drive around Coachella Valley and give showers while doing intakes and enrolling everyone in services. I'm also happy to announce that we 2 days ago were able to team up with Riverside University Health System, and we're going to be doing a monkeypox vaccination clinic next week at a local restaurant in Palm Springs. Some fun updates. So I always say like my starting point is July 1st, because that was when I went from a $0 budget to any budget. And so we've actually, as of now, it's 201 clients through our mental health program. We've connected 12 to housing and 54 to external services throughout the Coachella Valley. So very proud of that. Some highlights. So I created a QR code, which I'm happy to share. It's like the picture down in the bottom of free services that the clients can access while they're, in field, like while they're in, if they're living on, if they're unhoused or whatever, they scan it, because actually many of you may or may not know, a lot of unhoused individuals have cell phones or access to phones, and they can scan this QR code and it'll tell them where they can go nearby that's safe, affirmative, and affordable. I help advocate for a bill and policy. I got to meet Danny and the team a couple months ago already, right? For SB is 923. Oh, my brain is, I haven't had enough coffee. Launch of mobile shower. So we got 700,000 from the city of Palm Springs for the initial funding for our universal basic income pilot. We applied to the state. So we're going to get $1 million in total for private donations and Palm Springs. And then we applied for a match grant for the state. So it's our hope to get $3 million in funding to do UBI, which is, a fairly not newer concept, but a more talked about concept, where it's a pilot when we give monthly stipends to unrestricted incomes, just to see, does having universal basic income improve areas of mental health, housing, financial vulnerability. So we're kind of waiting right now. Hopefully we get the funding from the state, but it's our goal to launch this program January 2023. It's happening either way. It's just, are we able to serve 60 or 180? Just depends. So wish us luck. And then we launched our domestic violence wrapping rehousing program last month. So those are some highlights. Any questions so far? I can't tell, but I'm going to say no. All right. Client success story shared with permission. So I changed the name. Claire was one of our clients. She's a 16-year-old trans female, and she left her house due to very violent transphobia. When we encountered her, she had already been living on the streets for about 6 months and engaging in sex work. Very, very dangerous situation with the individuals that she was working around, and especially being underage, there was a lot of concern. We were able to connect her to resources. We worked with her for about 3 to 4 months, but we found a family member who had no idea that she had been kicked out of her home and was able to house her, and she's living with her now. I think she's just turned 17 and a half about. She's finishing her GED. She wants to go into mental health, and we still provide her weekly therapy. And recently she said that her parent, one of her parents, is have they want to come to a therapy session for hopes of reunification. So this is one of my favorite stories. And she said as soon as she turns 18, she wants to volunteer. So that makes me happy.
Hey, Jacob, we have a
Yes.
question from
Oh, sure.
Queen Shannon, go ahead.
Good morning, everyone. Hey, Jacob. So I wanted to ask regarding the housing resource, is that where is it available at?
Yeah, great question. So anywhere in Riverside County, which I learned a fun fact, it's one of the largest counties in the United States. So yeah, if your client lives in Riverside County, then we can help with that housing. It is a HUD funded grant for that area. So unfortunately, I can't bend the rules on that one. But thank you, great question. So yeah, that's a little bit about us. Here's contact. Please reach out to me. I'm the CEO, ED, clinical program manager, sometimes case manager, sometimes right. I kind of do everything. So if you need anything, please reach out, or if you want to be involved. So here are some things that we could really use help with. Housing. So I have 6 clients that have applied already for the domestic violence rapid rehousing. As we know, housing is really hard to find. I've been trying to contact landlords, trying to work out some sort of, prepayment plan. It's just people are really hesitant to take anyone that doesn't have income outside of our program. So that's what we could really use help with. We could also use help spreading the word about our clinical training program. So if you know individuals who are trying to get their social or their LCSW or their LMFT, we can help them earn their hours. The more clinicians we have, the more clients we can serve. And then finally, around UBI, just we need kind of help spreading the word. If you're working up in the state and you're like, hey, QueerWorks, they're doing this great thing, right? Just kind of getting the word out that this is something that could be really special. And we're just trying to get the program launched. If you are in the Palm Springs area and you do have clients, let us know. We're creating a community advisory board for the UBI, and we would love people to be on there. So yeah, that's me. I will stop sharing my screen, but take any questions so that I can see you all. No question?
No questions, but a comment. Amazing job, by the way. Amazing job you guys are doing. And thank you.
Thank you, and good to see you.
Thank you so much, Jacob. If folks have any questions or comments or even want to connect with Jacob, please reach out to Jacob via email. Jacob, do you mind putting your email in the chat as well as your website? I think it's really great for folks to be able to connect with you, bounce off any ideas. But thank you so much for sharing all of the amazing work that you're doing. Okay, so moving forward, do you have a project or program you would like to share? Really what we would like to do is every month do just like we did with Jacob, being able to highlight a project, a program, something new and innovative that you're doing. So that way other folks, can pick your brain, glean ideas, be able to connect with you. This is a really good way to build capacity, foster relationships, and share those challenges, barriers, and even strategies that you have navigated. I do see a hand is up. Jazzy?
Yes, hi, thank you so much. Again, thank you so much for that presentation, Jacob. I learned a lot, and I just followed you on Instagram to your organization. I definitely want to keep in touch. It's an amazing program that you're leading. I also wanted to extend an invitation to everyone here. I know some of y'all are in North Cal and like other parts of California. But if you happen to be in Los Angeles, next Saturday, my organization, Latino Equality Alliance, is throwing a forum for students, teachers, administrators, community members, basically anyone that wants to come learn about healthy school climate practices for LGBTQ plus youth. I will drop a flyer in the chat, but it's going to be a really great opportunity to learn about what LAUSD could do to implement more safety practices, more inclusive curriculum for our LGBTQ youth. So I'll share a flyer, and if anyone has any questions, feel free to DM me. But yeah, thank you so much, and thank you for holding this space.
No, thank you. And if you can also be sure to add your email address in the chat as well, so that way folks could also connect with you too, that would be great. This is exactly what we want and what we want to see, you know, everyone lifting each other up and supporting one another. So if anyone, you know, would like to present in future network calls, please feel free to email me and contact me, and I would love to set up a time for you to be able to share. And don't feel like, you know, like, oh, I already shared like a month or two ago, like, you know, we really want to build these relationships. You know, we cannot do this work without each other, and we really do need to support one another. So please email me. And like I said, I would love to set up time and continue to foster and build these relationships amongst one another. So I did want to share an upcoming funding opportunity. There is an LGBTQ Health Equity Initiative grant that is being released next week. The release date is September 12th, with a pre-application conference taking place September 15th. The goal of this grant, it is a broadly defined focus for capacity building that is designed to acknowledge the continual care of LGBTQ patients, clients, and community. So this is really about training healthcare providers and healthcare agencies. California Department of Public Health anticipates funding up to 8 program contracts, up to $400,000 each. Ari just dropped the link in the chat, so please everyone be sure to click on it, check it out, and view the application when it's released next week. This is a really, really important initiative. I know we've talked about how many times our community has been discriminated against. We've experienced trauma when seeing service providers, and this is a really great way to change that landscape and gain access to care for our community. Really quick before I go to questions or updates, I want to share some events that are going on across the state and even nationally. There is a webinar taking place, Our Bodies, Our Dreams, which is a trans reproductive health webinar. And this is a discussion where trans folks will share how the new legislation, especially since Roe versus Wade has been dismantled, really undermines our bodily autonomy. If you can share this with your network so folks can participate and learn more about reproductive health and rights and why this does include trans folks, this is really important for everyone to engage in. The next upcoming event and conference is the Gender Spectrum Conference, which takes place in about a month in October. This is going to be virtual. So please feel free to click on the link and register for the conference and attend. A lot of our partners will be speaking at this conference, including Trans Family Support Services, which is based in San Diego. Whoops, let me see here. The other conference that is coming up in October 13th is the EDGI conference. This is a gender diverse conference put on by Penny Lane Centers, and this is taking place in Los Angeles. And a lot of queer activists are, especially grassroots activists, are presenting at this conference. So again, the link is in the chat. Be sure to check it out and share it with your network and friends. Another conference coming up in October is the GLAMA conference. This is actually the 40th conference. It started in San Francisco, so it is going back to its roots and being hosted in San Francisco again. This is normally changing throughout the years at various cities across the nation. It is October 19th through 22nd, and our organization will be there, not only tabling at this event, but we will also be presenting on disparities experienced by Two-Spirit communities. We will be having a Two-Spirit panel presenting, which also includes one of our Out for Mental Health projects, Wendy Slater. So excited to present with Wendy. October 9th, Indigenous Pride LA is having a free event. This is going to be both in person and hybrid. It will take place from 11 a.m. to 6 p.m. and folks can log into their Facebook page, their Instagram, or even their website to watch virtually. We know a lot of folks cannot attend in person, so this is still a great way to keep community involved and being able to participate in something that means something very deep and personal on the cultural level. And thank you to Gender Justice LA for sponsoring this event. And then I believe finally we have Creating Change is also coming up by the National LGBTQ Task Force. Right now there is early registration where they have a discounted rate for folks to attend. This discounted rate is available until October 31st, but there are also scholarships that they're able to provide if you go and sign up for a scholarship. So please be sure to check out their website, apply for those scholarships, and hopefully you'll be able to attend. It is taking place February 17th through 21st in San Francisco. So with that, we really want to encourage folks to join our listserv. And if you would like a calendar invite to our monthly network call, please email Ariella at the email provided, and she is more than happy to send you a calendar invite with the Zoom link so you know exactly when these calls are happening, and you don't have to wonder, like, is it happening today? What's going on? Do I have the link? And you can also join, like I said, the listserv, receive our newsletters, all of the amazing things that we have to offer. So with that, I really want to be able to answer questions and allow folks to share any updates that they may have. Mike, I see your hand is up.
Thanks very much, Danny, and thanks to everybody for their great input during the call. I just wanted to offer that I'm a transgender man. I'm a professional medical writer and healthcare editor, and I've been presenting webinars on LGBT and terminology specific to sex and gender. And as a transgender man, people have been coming to me frequently for advice on such terminology. So I'd be happy to share that webinar with your organization if people are interested.
Thank you so much. Could you put your contact information in the chat for folks?
Sure.
Thank you. Does anyone else have any updates, announcements, events, or questions that they may have?
I have one quick one. The Connie Norman Transgender Empowerment Center in West Hollywood is celebrating their 1-year anniversary. This empowerment center is the largest empowerment center in the world so far that we know of. So come out and celebrate with us. It's Friday at 6 p.m. There's going to be press, photos, food, drinks, socializing, everything. And that's this Friday.
Thank you so much, Queen Shannon. Can you put that information in chat as well as your contact info?
Yes.
Thank you so much. Does anyone else have any updates, questions, comments, events they'd like to share?
Yes. Hi, everyone. This is Sonia again with Gender Justice LA. We have our monthly members meeting every second Thursday of the month. So that's today at 6 p.m. Via Zoom. And we actually are going to be joined by our coalition organization, Nourish California, to help us learn more about recent policy changes that would expand access to CalFresh, specifically for like undocumented communities, ages 55 and older. So if this is you, if you want to learn more information about that, feel free to come. I'll put the link on the chat, and I'll also type in my email if you ever want to collaborate, or if you have any questions about CalFresh for undocumented folks.
Thank you so much, Sonia. Alexander. Alexander, I see your hands up.
Hi, can you hear me?
Yes.
Awesome. Sorry about that. Thank you for this meeting and thank you for your time. I'm from the Central California Two-Spirit LGBTQIA Collaborative. And here in Stanislaus County, we're going to be hosting weekly monkeypox vaccines at our collaborative. And it'll be a full day of vaccinations. We have the flyer out on our websites, but I'll email them to you as well. And along with that, we're going to be providing the community with harm reduction products like syringe exchange program, Narcan, fentanyl test strip kits, COVID at-home test kits, and other products like that. So we're really looking forward to that and bringing more vaccinations and access to monkeypox vaccines to our community, in particular our BIPOC and our Latino and Black communities. Along with that, we're also going to be having some local monkeypox vaccine events at our local bars. The Brave Bowl on the 17th of September and the 24th, along with performers, drag performers, drag king performers, and some food trucks and other vendors for creating a health and wellness event to target the Latin community in particular out here in Central California. So we'll continue to share those flyers along with other events that we'll be having throughout the month to bring more vaccines to other areas in Stanislaus County in particular. And along with that, I did want to mention that now in Central California, we do have access to same-day access to PrEP, pre-exposure prophylaxis, which is a prevention from HIV. So we have a voucher program that you can come into our collaborative where we've partnered with the pharmacy to provide access to street delivery if you need it at $0 to a low cost of $79.95, which is really, really awesome. And along with that and the harm reduction that we're doing, we'll be providing free HIV and syphilis rapid testing with syphilis treatment on site and results with counselors and nurses. So we're really proud of bringing that health and wellness over to the Central Valley and kind of breaking those barriers and being able to give our community better access to these testings and to this prevention and harm reduction and information. So thank you everyone for your time, and I'm really happy to be here, and I look forward to working with y'all in the near future.
Thank you so much. So I know it's 11 o'clock and folks probably have other meetings they need to head to. If anyone has any other event updates or anything, please feel free to email us and we will send it out to folks. But with that, we hope you all have a wonderful Thursday and weekend. Please stay safe, everyone. Thank you.